Good morning, everyone, and welcome to the National Institute for Occupational Health's COVID-19 webinar. And this particular webinar, we will be looking specifically at the Occupational Health Surveillance System and provide you with an update. And without much further delay, I'm going to ask Professor Nisha Naika just to start the webinar for us. Thank you very much. Over to you, Nisha. And just to check if all our colleagues, that is both Dr. Totling and Lesedi, if your microphones and sharing functions are available to you before we proceed.
Thanks. Thanks, Ashraf.
Thank you very much. Over to you.
Okay, thank you, Ashraf, and welcome everybody. This is just a quick welcome to everybody on this webinar, and to say thank you for participating not only in the webinar but in the Occupational Health Surveillance System. And you will be able to see from today's presentations the value of your submissions so far. So there's just a slight change in the program, in that Dr. Nanhlanhla Toloteng is going to start the presentation, and then Lesedi will come in after with the OHSS submission overview. So I'm going to hand over to Nanhlanhla. Nanhlanhla, thank you.
Thanks, Nisha. Good morning, colleagues. I'm just going to share my screen. Yes. Can you see my screen, Ashraf?
Yes, thank you very much. It's maximized. Yes. Thank you very much, Nanhlanhla. Please proceed. Thank you.
Okay. Good morning, colleagues. Thank you so much for taking the time to attend the webinar. As Ashraf and Nisha has already introduced me, my name is Nanhlanhla. I'm an epidemiologist at the National Institute for Occupational Health. So I think most of you might have, interacted with me in the past year during the reporting of your COVID-19 data to the OHSS. So I will just provide feedback, like to you as our stakeholders on what your data is being used for that you regularly submitting to the OHSS. So this presentation will then touch on the key findings from the data from the 1 year reporting period of October 2020 to 2021. We had a lot of challenges in terms of workplaces not registering and with the inconsistent reporting. And if you can see there on the graph, which just shows the number of companies registration per month. So in the beginning, when the Occupational Health Surveillance System was, was starting out, we had a lot of companies eager to register, but the registration quickly declined. And then around March 2021, I think the directive then went out, which was then a legal requirement for all workplaces in South Africa to submit data. I think initially we said workplaces with greater than 50 employees, and then it went on to say that those with 50 employees can then submit COVID positive cases only. And then those ones with more employees can then submit the other data, which was symptom screening data, vulnerability, and the return to work data. So, that slightly increased in our registration period between March 2021 and April 2021. We also had a new legal requirement with the TELS, the Department of Employment and Labor, where now for those employees that qualify for compensation, they will have to submit the COVID-19 data through to the NIH, OHSS, and then they can go on to claim for the UIF TELS benefit. So that didn't really increase most of the workplaces to register, but we had most of the companies that are now submitting the data because of the UIF TELS. So toward the end of the year, we also had the Department of Employment Labor issuing a penalty to workplaces which are not complying with the directive, where a legal fee was then applicable to companies that were not registering and not complying with submitting the COVID-19 data. So this graph just shows the changes, as we introduce those legal frameworks in terms of the business registration and data reporting. So we also had additional challenges. Even we found that even companies were submitting data, but most of the templates they were incorrectly filled. Of course, we had some intervention strategies. We implemented validation of data, which also made it a bit difficult, for some companies, to when they had to submit data, they were not able to get around the templates. The system will reject the templates and the submission, and that really resulted in a lot of our data, compromise our data quality, and actually a lot of missing data. But the webinars also assisted. We had one-on-one training with our users, and we still continue to offer those training to users during the data submission processes, so that we can just increase and make the submission easier for companies. So we had 2 reports that are published on the NIH website. I will urge all the workplaces to just read the report and see what we do with their data. So we had the annual report, which was released in March in 2021. And then we have the annual report, which covers the data from end of October, which is now on the NIH website, which also shows the key findings from in terms of COVID-19 data. So these were the key findings, just to summarize it for you. So in total, we had about 5,000 companies, 5,363 companies that are registered on the OHSS, which was an increase of 2,252 companies since March 2020. So this formed about 1% of formal workplaces in South Africa, which is really not significant, in terms of, what the surveillance system had entailed to do. So the total number of employees that are registered by all companies, it was about 2,675,000 employees. So from this, we're also able to see from which occupational groups, most of the employees that were registered on the system. We see that elementary occupations, sales and service workers, clerical workers, as well as professionals formed a lot of employees that are actually registered, that were registered by employers on the OHSS platform. So with the data, with the COVID-19 data, this is what we found out. We found out that service workers, as well as professionals and clerical support workers were the most occupational groups that are reporting COVID-19 cases. Actually, this as one of our indicators, we're able to also classify high-risk employees in terms of sex, age, and comorbidity. We also see from which provinces the positive cases were being reported, and also from which industries were most at risk of COVID-19. So I'm not going to really go through all this. These are all in the report. I think that the purpose of my presentation really was just to give you a highlight of what we have found out from your data that you're submitting. So if you want to, the complete report, it's on our website. We'll turn this report into infographics, which will also be distributed to all our stakeholders. And then our dashboard, the NIH Live dashboard is also being updated. So this, you can also see, per occupation, you can see the comorbidities and data, the employee return to work data. So this is also all in our website. It has also been updated after we combined the data from all the platforms, the CSV, CIMO, and the API platforms, which was submitted to OHSS in the previous year of reporting. So just to conclude, as I've indicated, we had a challenge, with workplaces complying with the legal requirement of data submission, which was mandatory in the previous year. And also we had a lot of problems with incomplete data, with inconsistent reporting. But we were able to, as a conclusion, we just were able to report that we have an insight into what's happening in, we had a COVID-19 infection in South African workplaces. So we were able to see that the three occupational groups that I've listed, service workers, professionals, and support workers, the most reported COVID-19 cases. This is maybe due to the nature of their work, like being in interaction with a lot of customers and all that. That's our hypothesis. And so however, with the data, we're not able to determine the impact of the COVID-19 in the whole industrial sectors due to the poor registration and also the data submission. As I've said, our registration was very low, which was 1%, and of the workforce in South Africa. So from that, we cannot really say what impact COVID-19 had in the different industries. So I think that's all from my presentation. I think I will take questions later on, or you can just put them on the chat box. Thank you.
Well, thank you very much for that, Dr. Nonhlanhla Tloteng. I think this is a very important tool, and I'm not sure if Professor Naika wants to sort of add anything to your presentation there. Alternatively, we will proceed to the next presentation by Ms. Lesedi Moniwa. Over to you, Professor Naika.
Thanks, Ashraf. No, I don't have anything to add, just to highlight the importance of reporting. And probably the group that's here are already reporting, but we would appreciate any awareness to out there to get other businesses to also start reporting, so that the data will be more relevant to everybody. I see there are two hands up. Ashraf, are you taking open questions? Oh, you are muted, Ashraf.
Apologies. I hope I wasn't muted earlier as well. So the hands will take once all the presentations are done, and then we will probably have time later on. My proposal is we proceed to the next presentation, unless you feel that we should perhaps consider the. I see the two hands now. The first hand was up a while back before the presentation. Nisha, do you think we should proceed with taking the question?
Maybe we can take the question quickly, since Mishasha will have to leave after
after
11. Yeah.
Okay, so I'm attempting. I see Kirshni Naidu's got a hand up, and Sinavuyo and Candace, etc. And I'm trying to just give them they'll see something pop up on their screen which they need to activate in order to have their microphones activated. So I'm going to ask the first person. I think that was well, now the names have disappeared. Well, Candace's hand has also now disappeared. So I'm not sure. I've just activated somebody, and the name is it Krishni? Okay, yeah, there you go. Krishni Naidu, is your microphone open?
Yes, I have. Can you hear me?
Yes, please proceed. Thank you very much.
Okay. So I just happened to see that a number of industries and organizations have not complied with the NIO requirements. And I mean, we have painstakingly made sure that we comply, and it's taken a lot of time and resources, and we were quite diligent in doing so. So I'm quite interested in knowing, because we didn't really receive much feedback or correspondence or anything of that sort in terms of our compliance, but we made sure that we even got consultants in to help us with the whole reporting, because, you know, as it stands, it's now just maintaining that reporting that we've done initially. Initially, it took a lot of time, a lot of effort, and I think our occupational health unit can even vouch for that. But I just want to know, what would the consequence be for those who did not comply? Because of course there has to be a certain amount of fairness that's being applied. If we're given these policies and we're asked, and these are regulations, and we are complying with them, I just want to know that it was fruitful. It wasn't, you know, us doing this exercise and going through all the pain, and it was for nothing. So I'd just like to know, what is the consequence? Thank you.
Thank you for your question. I hand back to the presenters. Thanks. Prof, I'm not sure if you want to start on that one.
Okay, no, I mean, the data is valuable, and we do appreciate it. With the feedback is comes via the dashboard that is on the website, and if you are submitting a CSV file, you would get a message saying that your uploads, you know, have been cleared, or so. So we are getting the data, and we are processing it. The information is on our dashboard. We do acknowledge that we haven't been sending out reports, you know, monthly or so, but because we have that dashboard on the website, and we have the annual report that has just come out, there is, I know some of the questions that have also come up is there a penalty? There is a penalty if you don't submit data. The problem is that the implementation of that penalty, because it only comes in when the inspectors from the Department of Employment and Labor actually come to the company and audit that company. And then otherwise, because we don't have a denominator or a database of all businesses that should be submitting, we can't say who is not submitting. All we have is the people that are complying with the system itself. And that data is you know, fed into the OHSS and is then accessible to the Department of Employment and Labor, Department of Health, and obviously the Unemployment Insurance Fund as well. I'm not sure if Nhlanhla would like to add anything to that.
I think you've. Oh, sorry.
Go ahead, Nhlanhla. Apologies. Go ahead.
No problem. Yes, I think Nisha has covered a lot of things from Karishna's question. So there is still, I think the penalty fee still applies for companies that are not complying. And in terms of, how we utilize the data, I think, like she said, we have, if you go to our website, we have regular, in terms of report, what to do with the data, but really, we're collecting this data, as a public health surveillance, just to, to also be able in the future to inform policies in regard to, transmission of, at the moment, COVID-19 in workplaces. So the data that you're collecting is really, really useful, not only for NAIO, but also for the South African workplaces.
Thank you for that. There was another person whose hand was up, and I've Marika White, and then I want to go to the questions that are in the Q&A box for this particular presentation, and I think there may be a few in the chat. Marika, please proceed.
Good day. Yes, since the new system's been implemented for about the past month, I just cannot submit. It gives me an error message for everything I submit. And if I actually look in the chat box, a lot of people are having that same problem. I've emailed the helplines from the NIOH, the emails, and I've gotten no feedback. So I've been trying to submit, but the new system, it just gives me an error message every single time. So I'm quite, it's not that I don't want to submit, but I really don't know what to do anymore.
Okay, thank you for your question, Marika. I'm handing over to the presenters.
Okay.
Oh, Nisha, can I go ahead?
Please. I think you're going to touch on this in your presentation.
Yes, I'm actually going to be going into detail about this in my presentation, and I'll be giving out all the solutions and what needs to be done if you're having trouble in terms of submitting the CSV files.
All right, thank you very much.
Yeah, thank you very much for that, Lesedi, and thank you for your question, Marika. Is that Molatelo? Do you still want to ask a question? I'm going to, whilst I wait for you to be activated, there's a question here by Izetu. Hi, I just want to find out what happens if the return to work data is not submitted, but the COVID cases have been reported. Is it compulsory to submit the return to work? And I see, Prof, that you want to answer that question live. Do you want to proceed?
Oh, yes, sorry. I pressed the wrong button. I meant to type it. But yes, it is important to submit the return to work, because that's how we know, what has happened to the positive employee. Did they manage to return to work? Was there some sort of disability? And so on. So that is important information that will help us to assess the impact on the workplace.
Thanks. Nhlanhla, please just jump in if you want, if you need to. I'm going to proceed to the next question. So from Normalo, we've been trying to report for 4 months after our link was cut and used every avenue available to contact the NIH and have not received help. What do we do now? I see that there is answers being typed for you, but I'm not sure if anybody just wants to quickly respond to you. That may have been covered, but and obviously Lesedi will get into much details there. Do I accept that we'll cover that in the next presentation?
Yes, I think so. Yes,
okay,
I think maybe we can move on to the next presentation now.
Okay, I think a lot of them is dealing with that now. And just to then check with my colleague Lesedi, do you have the share screen function available for yourself? Okay, and whilst we check that, just a reminder to everybody, please type your questions in the question and answer box. It's easier to manage there. I've not yet had a chance to scroll through the chat box, because every time you type the chat box is sort of, a moving target, whereas the question and answer box is designed for all the questions to be easily visible. So I will scan through the chat box to see what questions are there, and I'm going to encourage my colleagues also to have a quick look there. So our next speaker is Ms. Lesedi Moniwa, and apologies, that's Monawa, and she is our coordinator for this very important project. My apologies for my bad tongue there, Lesedi. I want to hand over to you. If you could just share your presentation in the meantime.
Thank you so much, Ashraf. I will be sharing my presentation just now. Just give me a moment. Okay, there we go.
Okay. Yeah, and then for those who need to follow up on things, we will check up on the different channels. There is the email address info@NIH, which is generally coming through for training purposes, but OHSS matters are also referred over to the colleagues. There is the OHSS email address itself, as well as obviously the phone number there. And I must admit, we're trying to do quite a significant project and task, and it would be great if we had lots more resources. Okay, Lesedi, I see that your presentation is now visible. If you could just maximize that for us, because we can see your draft slides also on the side at the moment. I think it's usually some little icon at the bottom that looks like a little screen, a little.
Okay, let me just try resharing again, because. Okay.
Okay. Yeah, thanks. I see there's questions from Trevor Anonymous. If you could just change your name there, please, because it's useful for us to know who we're responding to, and it maintains a record for us. Leonore, Daniels, Shishle, Sorita, Candace, Petulia, Rosemary, Laura, we'll get to your questions later on. And I'm sure you might find that some of your questions are already covered by the presentations.
Ashraf, how does it look now from your side?
I still see the little, what do you call, the draft slides on the left, or the smaller ones. And have you clicked that little small icon at the bottom? Yeah, that one.
Yeah.
Okay. Would you like me to share it maybe from my
Please
side?
share it from your side.
Okay, one moment, and I will find it here.
Stop sharing from this side.
And this is the last. Yes. Okay. Right. There are some people who've typed questions in the chat. If you could copy your question from the chat and put it in the Q&A box, that'll be brilliant, because that'll be our complete record of the questions that you've shared with us. So if I could just quickly go through the quick steps of sharing on my side, and I think I've got the right. Yes, it is. One moment. I may have to move this in a place where it's easier for me to manage. Okay, apologies. I've got screens over screens. I'm not sure if you can still see that. I may have to reshare that. Okay. Do you have the full screen visible on your side?
I can see it, but it's more of the presenters.
Okay.
Yes.
One moment. And that would have swapped it.
Yes, it's
Okay, thank you very much. Apologies for the technical delays, everybody. I hand you over to our presenter, Lesedi, who's going to deal with all of the little technical and important things. It'll probably answer most of your questions. I hand over to you. Thank you.
Thank you so much, Ashraf. Thank you so much for everyone attending this webinar. My name is Lesedi Munaiwa, the project coordinator for the OHSS system. I believe most of you have interacted with me on several accounts. So today I'm just going to briefly go through redefining what is actually OHSS, the purpose of it. And also I'll go into how the system actually works, how you get to do the reporting, how do you deal with the challenges that you guys have raised so far during this webinar. All right, Ashraf, can we move to the next slide, please? Okay, so this is the outline, as I had mentioned before, that I will actually define the system and its intended use, the purpose and objectives of the OHSS, what data is actually collected, how is reporting done and by who, how we get to manage and store the data, as well as the registration and reporting process. Yes, we can move on to the next one. So surveillance is a mechanism by which public health agencies, such as the Department of Health, use to monitor the health of populations or communities. The goal of surveillance generally is to provide a factual basis from which the agency can appropriately set priorities, plan programs, and take action to promote and protect the public's health. We can move to the next one. So what is public health surveillance? So below is actually the accepted definition for public health surveillance, which is the ongoing systematic collection, analysis, and interpretation of health data, essential to the planning, implementation, and evaluation of public health practice, closely integrated with the timely dissemination to those who need to know. Ashraf, the next slide, please. Okay, so OHSS is actually the Occupational Health Surveillance System, which is a tool used to initiate mandatory reporting of COVID-19 related cases and monitor the impact of the disease within the workplace in South Africa. So the goal of this initiative is to actually ensure that occupational health data related to COVID-19 collected during the state of disaster is actually appropriately governed in terms of the use of scientifically and technically sound instruments, collected ethically, housed at secure servers within mandated agencies, scientifically analyzed and appropriately reported, and the access managed for research purposes in order to advance broader OHS goals generally, and address interventions to reduce the impact of the epidemic. So the purpose of the OHSS, it was actually developed to initiate mandatory reporting of COVID-19 cases and to monitor the impact of coronavirus within workplaces in South Africa. So the purpose is to evaluate the impact of the COVID-19 interventions in the workplace, to provide regular updates on the trajectory of the pandemic in economic sectors nationally, to monitor the distribution and factors associated with COVID-19 disease across workplaces and industries in South Africa, to understand the post-infection and return to work health outcomes of the employees. So if we can just go back to Dr. Nonhlanhla's presentation, in the report, which is also available on our website, if you go through it, you actually get to see that we've actually tried to cover most of the purpose of the OHSS system. In the report, you get to see the purpose of the system, the data that we actually managed to collect and what we actually got out of it. We can move to the next slide, Ashraf. So the objectives is mainly to develop a framework for a COVID-19 surveillance model for monitoring workers in various economic sectors, both in the public and private sectors, and to early identification of sectors, companies, and occupational groups at high risk of infection, so as to inform appropriate interventions, such as policies, programs, and resources. To understand the impact of the COVID-19 interventions in the workplace, determine the human resource and economic impact of COVID-19 on the various sectors, to provide strategic insights through data analytics and visualization into all phases of the COVID-19 infection spectrum in the South African workforce, and to identify key scientific questions requiring further investigation. We can move on to the next slide. So what data is collected? So we are collecting COVID-19 related data. Next slide, please. So the following data is collected from businesses, all businesses in South Africa. The first one is the symptom screening data. Since the country was declared a state of disaster, all employers in the country are legally required to screen all employees entering their work premises on a daily basis. This screening must be based on the prescribed set of symptoms as has been defined by the National Institute of Communicable Diseases to determine those persons likely to be presenting with a COVID-19 infection and therefore should be referred for further assessment. This daily collected data must then be submitted by employers employing 50 plus employees to the Department of Health through the OHSS platform. So this 50 plus threshold, I think we've also had a lot of questions around that. So what it basically, it actually applied on businesses employing more than 50 and above employees, that they're actually required to submit the symptom screening data by not latest of every Tuesday for the previous week. The data must be submitted on a weekly basis. Should there be symptomatic workers recorded during the calendar week, the submissions should occur before Tuesday for the previous calendar week commencing on Sunday. The data required is indicated in the prescribed symptom screening template, which I will go through it with you guys in my next slides. We can move on to the next one, Ashraf. So this is an outline of the symptom screening data that we are collecting or is being submitted by you guys. So on our templates, which I will also share with you guys in my presentation, the symptom screening template on both our platforms, the CIMO platform and the CSV platform, as well as the API, the templates are actually the same across all three different platforms that you get to choose to submit your data through. So this is the type of data that is collected across all three platforms. We need the business ID, which is actually generated by our system upon registration. So it's a unique 36-character business ID that we send to you guys to identify your businesses. And that's the one that we actually require every time you fill in your symptom screening case or you log your case. So you need to make sure that your business ID is there. It's actually a compulsory field. We've got a field for SA national ID. On the symptom screening data, SA national ID or passport number is actually not compulsory. However, our system does not allow you to leave the field empty. So therefore you can put any 13 digit characters there if you do not want to disclose the employee's national ID number or passport number. And then we need the date when the screening was done. Our dates on all templates, we have a specific format, which is year, month, and day. So you need to follow that format all the time. Employee age, it's also a compulsory field. You normally take 2 digits, whereby you'll just type in the number of the employee. Employee sex is also compulsory, whether it's male, female, or other. You cannot leave those fields empty. So as you go down this table, you can see the fields that are actually compulsory, they are listed, and those that are optional are fields that can actually be left empty, and you can still submit your data and your case will be submitted. But should any of the compulsory fields be left empty, you won't be able to submit your data. And it's also actually one of the other reasons why some of the CSV files are actually being rejected when you try to upload them, especially on the CSV platform. So I'll also go more into detail later on at the stage of this presentation. So we've got the symptoms, whether they are present, yes or no. There are drop-down options that are given there. So you need to answer all of that if there's any. And then the screening outcome section is also optional. You can leave it empty, you'll still be able to actually submit your data. We can actually move on to the next slide. So the next type of data that we collect is the COVID-19 positive test data. Based on their daily symptom screening or on their employees' presentation to their health provider, employees are referred to health providers or health laboratories for testing for the presence of the COVID-19 virus. In terms of managing the pandemic in the workplace, the employer is expected to be notified of the results of the test. The results of the laboratory test of all employees who test positive must be submitted by employers upon receiving the results of such tests. In addition, employers need to submit details in the positive case template for such individuals. This submission occurs only when an employee tests positive for COVID-19 and should be submitted on a weekly basis should there be positive workers identified during the calendar week. The data required is listed in the prescribed positive case template, which I'll go through with you guys just now. So just to answer, earlier on, I saw a question that came through. Someone was asking if, do they need to report if there is no case at the moment? So I also responded to that on the question and answer. So you only report if there is a case. You actually report as per case arise. So if for the calendar week, there was no positive case, there was no positive symptom screening, that means that you've got nothing to report on the system. We can move on to the next slide. So this is how, this is the outline of our positive test data. So just to also mention that on all our CSV templates, that are available on our website, and we also get to share as per request. When you open those Excel templates, there's a tab for which actually has got this outline that I'm sharing with you guys that actually get to explain the type of information that you need to fill in your template. So just make sure that you make reference to it in case you do not understand or you just like to know which fields are compulsory and those that are not compulsory. So if you look at our templates, the first section is actually almost the same. The type of information that we collect is almost the same. You see also in this one, we still collect the business ID, employer, which is generated. We also collect payroll numbers if there is. We also collect SA national ID numbers or passport number. So on the positive test data, it's important that you have the correct ID number or passport number, because this is the type of information that is actually submitted to the Department of Labor for test compensation purposes. So should your ID number be submitted to us as a positive case and it's incorrect, that is the ID number that will be forwarded to the Department of Labor, and which means that should you wish to claim for TERS, you wouldn't be able to claim because they wouldn't be having your correct ID number or passport number. So which is actually one of the reasons why we actually got to move on to the new system, the CSV platform, and we actually became more strict. The rules here were actually more strict as compared to the previous platform which we had, which was Nextcloud, which used to just accept anything else. But with the new system, when it comes to ID numbers, it does not take anything that is less than less than 13 digits. So which we actually put this rule so we can ensure that information is captured correctly from the user's side, so that when it gets to us, at least it ensures that we get correct data and we get to forward correct information to the Department of Labor to avoid having back and forth at a later stage. So you always have to make sure that your ID number is entered correctly. It's 13 digits. If it's a passport number, we've also been communicating with all users that if it's a passport number, because passport numbers then don't have like 13 digits. So what you would do at the end of your passport number, you would actually just add 5 zeros, or you add zeros that would make it a 13-digit number so that the system can actually allow it. And then the date, you follow the same format that I shared with you guys earlier. Province, district, it's a compulsory field, industry, sex, and age, all compulsory field. And then job category, this is compulsory. If you can think back to the presentation that Dr. Nonhlanhla shared with us earlier, you got to see the projections, actually the reports that we got from her that was actually published. You can see how we actually analyzed the data and actually got to break it down into job categories and getting to see workers that are actually at high risk or that presented were actually scored higher in terms of COVID cases during this pandemic, which actually gets to give us more information on how COVID-19 actually affected certain job categories in the South African workforce. So we've got the test date. You follow the same format that I shared earlier. Test type is also still compulsory field. You get to choose from the list of options that you're given there. Symptoms, whether they were present or no. That's a compulsory field. It has to be a yes or a no and cannot be left empty. And number of high-risk workplace contacts is also compulsory. You type in, it's a number, it's a free text column. You type in the number of high-risk employee contacts. And also whether the employee is actually vulnerable, yes or no.
And sorry, Lesedi, we can't hear you. I'm not sure if it's just on my side.
Okay, can you guys hear me now?
That's great, thank you. It was just a couple of seconds, thanks.
Okay, great.
You're talking about the vulnerability factor.
Okay, thank you so much, Ashraf. So yes, so on vulnerability, I'll actually get to explain more when we get to the vulnerability data template. And then the post-test result action, that field is also compulsory. We want to know whether after the person tested, did the person go on sick leave? Did they go on to self-isolation or at a quarantine site, or they were hospitalized? So this is actually one of the informations that we actually get to collect more of it, especially in the return to work data. We shall also get more into detail when we discuss it. And then exposure contact type, it's also compulsory. Here we want to find out the type of people that were actually exposed during the employee's infection period, whether they were work contacts, community contacts, family contacts, large event contacts, travel history from a designated hotspot, public transport, or unknown. So you get to choose one of those options that are listed there. And then the reporting action done, this is actually an optional field across all three templates. So can we move on to the next slide? Okay, so this is the return to work data that we collect. All employers who indicate employees have tested positive must submit information about the outcome of the infection and the return to work decision. So no confidential clinical information is actually required here. This data must be submitted once, only when the employee returns to work. This is the period the employee gets back to work after they've been to isolation or quarantine due to COVID-19. A return to work template therefore needs to be filled in and then submitted by the employer to us. Recovery of employees from the infection will vary based on vulnerability and other risk factors. The data required is listed in the template I will be getting into in the next slide. We can move to the next slide, Ashraf. So this is the type of data that we collect on the return to work template. The first part of it, as you guys can see, is very much similar to the past templates that I've discussed. Same as to job category section, it's always the same. It's also still compulsory. So on the return to work data, we want to find out if the person was hospitalized or not. So it's possible that the employee might have not shared the information with the employer. So if you don't know whether the person was hospitalized or not, then it would be unknown for you. But this is a compulsory field, you can't leave it empty. So you have to choose between the three options that are given there. And then hospital type, this is also some information that as an employer you might not know. So you have to select private or public or unknown. And then the next part of it is also very critical. We want to know the date of admission, outcome, whether the person was discharged or the person died, also the outcome date. But bear in mind that this section is actually only applicable to you if you had answered yes for hospitalization. If it's unknown, then you can submit the sheet without even having to fill this section out. If you had said yes on hospitalized, then this field becomes mandatory to fill in. And then the next stage is the return to work date. This date is very important and critical as well. You have to fill it in. We need to know when the person came back to work. And this is the date that is also submitted to the Department of Labor, which is one of the reasons why it's very important to have it filled in. It's the dates that the Department of Labor actually uses to calculate the time the employee got to actually be away from work for the compensation purposes. And then we also collect return to work fitness level information. It's also compulsory. We wish to know if the employee, when they came back to work, were they fit with some restrictions, or were they fit for the job description, or were they fit with accommodation, or were they temporarily unfit for job description, or unfit for review, or permanently unfit. So you get to choose one of the most applicable option there. And then compensation claim. If you had claimed for any compensation for this employee, you get to select yes or no. And then the percentage disablement is an optional field. If unknown, you leave it as unknown, or you can actually even leave it empty. We also want to know the start date of illness. It's a compulsory field. This is also where we actually get to get a picture of how severe the illness was on this particular employee. So that is the start date of illness. Illness type, you get to choose between mild, moderate, or severe. And then end date of illness, which is the date when the employee actually was actually healed or fit to actually come back to work. Ashraf, we can move on to the next slide. Thank you. And then the vulnerability data. So all employers are legally required to identify those employees who are considered to be vulnerable for the more severe outcomes of the COVID-19 infection. Since this is a key component of the screening of workers, this data must be submitted by employers to the Department of Health. The vulnerability status of each worker that is submitted is not dependent on the availability of detailed medical information being available to the employer. This once-off submission is submitted when collected by the workplace, and any subsequent occasion when new appointments are made or an employee status requires updating. The data required is actually listed in the next slide. We can move on to the next slide. Okay, so this is the type of data that we collect on our vulnerability template. So the type of data that we collect also, the employee ID number or passport number is important because we have to report these cases to the Department of Labor. And should that employee or the employer want to claim for the employee for the test compensation, they would have to have this correct ID number actually registered with the Department of Labor. And then business ID, the same business ID that was generated upon registration, date, province, still the same information as we have discussed in our previous slides. Job category, still the same information, and still compulsory. And then a vulnerability status. So obviously, if you are completing this template, it would have to be a yes, because this is a vulnerable employee. Based on the conditions that are actually listed below, which I'll be getting introduced now. So the types of people that are actually deemed vulnerable to COVID are the following. So employees that are actually above, who are actually 60 or above, the age of 60 or above, those are actually deemed as vulnerable employees. People that are pregnant at the 28 weeks or over, people that are smoking, people with asthma, chronic lung disease, diabetes, hypertension, serious heart conditions, chronic kidney disease, chronic liver disease, immunocompromised, TB, had previous TB or even currently suffering from TB, people with HIV, or people that are obese. So these are the type of people that we normally, that are actually deemed as vulnerable to COVID-19. So these are the type of employees that you get to report them to under the vulnerability template and report them to us. Then we also submit the data to the Department of Health. So with this one, you only have to submit it once. Like for instance, if someone is asthmatic, you only report that once. Unless you know, someone is now probably was previously asthmatic and then now they are pregnant and the pregnancy is at 28 weeks or over, then that is the only time that you would be actually reporting the same employee twice. But other than that, once a vulnerable employee is actually reported to us, there is a once-off submission. You don't have to do it weekly, just like any other type of cases. Thank you, Ashraf. We can move on to the next slide. So the OHSS is an electronic system which was developed to house the data collected. It is a fully electronic system with 3 different platforms for users to use when submitting data. Businesses have to first register their company on the OHSS webpage. During registration, companies get to select their preferred online submission platform. Once you're registered, businesses will receive an auto-generated login details for the chosen online platform. So below are the 3 online platforms that we have for the system, which is the CSV upload platform, and then the CMO platform, as well as the application programming interface, which is the API platform, which I'll explain all of them in the next slides. We can move to the next one, Ashraf. So this is how our CSV upload platform looks like. So on this platform only expects or accepts Excel CSV files, nothing else. So when you log onto the system, after you've registered, you will receive your login details. And let's say you've chosen the CSV upload platform, you will receive your business ID, which is what you use to log in, as well as your password that would have given it to you, which you're actually also able to reset from your end and change it to whatever password you want. So when you log in to the system, this is how your screen will look like. The first tab is the company information. Here, you are actually able to go onto this and actually make any changes to your company information and have it updated immediately. company information. For example, if you have a new contact person for your business that you would like to add onto your company information or update, you can go on there, change and put on the details of the new contact person for your business. And then the second one, this is where you go to when you want to upload your file. So when you want to upload your file, you click there. And the first tab that you will see, you would actually have, it will guide you. You have to select the type of file that you want to upload, which would either be the symptom screening template or vulnerability template or the return to work file or the positive case file. You select that one, you get to choose your file from your computer, and therefore you get to check CSV file. And it will, the way our system is built is if there's something wrong with your file, it would detect it immediately as soon as you upload it, and it would let you know if it will give you an error. So most of these errors, they are not as self-explanatory, especially to people that are not into, I'd say, IT. So it becomes more Greek. But the more you get to know the system, the more you get to understand it. So if everything is well with your file, a green button will pop up, which would say proceed with uploading your file. So you would click on that one. But if at that stage it detects something else that is not right in the file, it would not submit it. But if everything is fine, you'll get a right green tick that tells you that everything has been submitted successfully. And once that is done, you can go onto your submission history to view all the submissions that you've done to see if they were all successfully uploaded. And also when you get to your submission history, there's a tab, you need to select the type of file that you want to check whether it was uploaded successfully. So you go on, if it's a positive test case that you had just uploaded, you need to select positive test case and then click on the gray button that will say get data, and then you'll get to see all the positive cases that you've uploaded. You will have the ID numbers will be visible there. The date of the date that you had submitted that case will also be there. We can move on to the next slide. So this is basically how our templates look like, where you actually get to capture your information or your cases on the different types of templates. So one thing that I would also like to stress is that it's important that everyone actually gets to use the prescribed templates. Yes, it is a guide on how your data needs to look like when you are submitting it to us, but it becomes much easier if you use the exact templates that we send to you guys or is shared on our website, because it's pre-formatted. Everything is as it's expected to be. So when you use that one, it becomes very easy. And it's also important to remember that you don't change the wording on the headings, don't add any extra columns or any, that is actually not required, that is actually not listed here. Like, for example, I'll make an example. Let's say you add a column for your employee names to make it easier for you. But when you submit the data, please be sure to actually delete that column, because our system is built to actually expect the number of columns that are actually in the prescribed templates, and nothing more and nothing less. So should your template actually have more columns or less, your file will definitely be rejected on the system. The system would not take it. That applies to all the different types of templates. We can move on to the next slide. This is how the symptom screening template look like, as well as the vulnerability case template. So if you can look at the templates that we've actually put up on our webpage, most of them will actually have some information pre-populated there. So this is just some dummy data to actually guide you on how to actually populate the data, or how the data is actually expected. So just be sure to actually delete this example before you can submit your data. because this data is just a dummy data, like explained before. It's just there to guide you, but be sure to actually delete it from your submissions when you are doing your submission. We can go on to the next slide. So the second platform, that's the CIMO platform, which I think a lot of our users have found it very easy to use. It's available on the CIMO webpage. It's also available on a CIMO mobile app. So it's very easy to use. You go onto it, you create your event. It also has the templates here, are exactly the same as the ones that we use for the CSV platform. So the difference between the two platforms is that with CIMO, you actually get to fill in an online form. That is you answering the template. And you get to do that. That means you'll be logging the cases one by one, as compared to the CSV platform, whereby you can capture all your positive cases on one positive case template and then get to upload that at once. So the CIMO app is actually more practical and easy to use to small businesses that actually don't get to report large number of cases whenever they do their reporting. So if you're getting smaller number of cases, you can use the CIMO platform, and it's not strenuous at all. We can move on to the next slide. So this is the CIMO template. If you look at it, so this is how it looks like when you log on and click on create new event and you select, let's say, positive test. If you look at the template, it's exactly the same as the one that we have for the CSV upload platform. So this is what you do. You just go on there, you fill in all the information that is required, and then you click on create event, and then your event is logged. Also, you need to make sure that the rules apply, that the rules that are actually discussed in the CSV platform templates, like the business ID, the ID numbers, you have to make sure the information is correct so that we receive correct information to submit to the Department of Labor. We can move on to the next slide. So the API submission platform, this is a platform that is mostly used by large institutions that actually collect large data, COVID-19 data from their employees, and would have hundreds of submissions to do. So what happens here, if you're a large business and you actually have a system in place that actually collects this data from your employees, what you do is you can go for the API submission platform, and therefore we would put you in contact with our IT and they can set it up for you so that your system can actually get to just feed into our system automatically. But yeah, it's a, like I said before, it's a platform for businesses that already have a system in place, an automated system in place. So if you don't have an automated system in place that collects the data that we need, unfortunately, you cannot use the API submission platform. We can move on to the next the next slide. So the OHSS management side, from our end, this is how it looks like. We get to see all the businesses that have registered with us. We can get to see those that are specifically with CIMO. We can get to see those that are specifically submitting through the CSV upload account. We can actually get to draw submission stats. Like for instance, if your business has made some submissions and we just want to have a look at one specific business's submissions, we are actually just draw or extract that particular business's submissions. And then we also get to see all the screening data collated, positive test data, vulnerabilities, return to work, and so forth. So this is actually our management side, how we got to manage the system from our side. As in terms of the API accounts, those are fully managed by our IT department. We can move on to the next slide. So all workplaces in South Africa are actually required to submit below various categories of data. All departments at local, provincial, and national levels of government are also required to submit data. I think Dr. Nonhlanhla in her presentation earlier, she also emphasized that it's actually a legal requirement for all businesses to actually submit this data to the Department of Health. As I've also mentioned earlier, that the type of data that is collected is a symptom screening data, positive test data, vulnerability data, and return to work data. So if you look at this, the symptom screening data, I also mentioned this earlier, that it's actually compulsory for companies with 50 plus employees only. Companies with less than 50 employees are not required to actually submit the symptom screening data. They can submit, but it's not compulsory, the symptom screening only. However, it is a compulsory for all companies, whether with 50 plus or less employees, to submit the positive test data, vulnerability data, as well as the return to work data. A national policy framework influenced the mandatory reporting of the COVID-19 workplace data to the OHSS. Dr. Nonhlanhla also mentioned earlier that there is actually a penalty for businesses that do not comply with the directive to actually submit this data to us. We can go on to the next slide. So I saw also in the text, someone was asking about POPI Act. So all the data that is submitted under this guideline strictly adheres to the Protection of Personal Information Act. Guidance note on the processing of personal information in the management and containment of COVID-19 pandemic in terms of the POPI Act by the information regulators. To maintain confidentiality data, we do not collect employee names, and businesses are assigned a unique identifier number. This unique identifier number is the business ID that is generated and sent to you upon registration. ID numbers, passport numbers are shared with the Department of Labor for TERS compensation purposes only, as per legal legislation by the Department of Labor. We can move on to the next slide. So I'd just like to acknowledge the Occupational Health Surveillance System Scientific Committee, the Data Management and Technical Committee, which includes CSIR, NIOH, and NICD, legal and operational team at the NIOH Epidemiology Department, Ford Funding for sponsoring the project, NIOH, NHLS, as well as business or OHSS users, which are actually gathered here today. I just want to thank you so much for actually participating and actually submitting the data to us. Most of you were very eager on this and very consistent with your submissions. For that, would like to thank you. If it wasn't for you guys, this project wouldn't be standing today. So I've come to the end of my presentation. I know a lot of you still have a lot of questions when it comes to submitting the data. So last year, we actually hosted a webinar whereby we went a bit more technical on how to submit the data, how to submit this, especially the CSV with the CSV platform, on how to submit and upload the CSV upload documents. But from that, we also realized that CSV files, they actually can get very complex, and most of the errors that people get would be, you'd find that the file is actually affected by their own computer settings or different issues. So we realized that most of our users are actually having different difficulties. Yes, the issue would be failing to upload a CSV file. However, when you look at what is wrong with the CSV file, it's quite very much different from the other user. So what we ended up doing is we started offering one-on-one CSV upload trainings. So what would happen there is upon request, we would set up a virtual training session between myself and the user that needs help. And then during that session, we will actually use, we offered this virtually via Zoom or Teams. So during this session, we actually get to do it step by step. I do it together with you. You get to do the upload from your side on your computer while sharing your screen, sorry. If there's something wrong with your template, we'll start there. So before that, I would actually request that you send me your files. I have a look at them and get to see what is wrong, what is preventing you from uploading the file. And by that, I'm able to actually now know what we are actually going to look at, the issues that we are going to look at and resolve during our session. So it gets to be very specific on your challenges that you are facing as an individual when it comes to uploading this. And this, we found it to be very successful. We've hosted a lot of trainings. In December alone, I think we hosted more than 20 trainings with some of the businesses where, and I tell you this, after that session, most of the users, they are now able to actually upload the file on their own. They know exactly where they were going wrong and how to tackle that. So I'm also here to just encourage all of you that are still having those difficulties in terms of uploading the CSV platforms to actually email me directly, and then I will set up that Zoom or Team session, and then we will look at your challenge individually and get to sort that out during this session. It's normally a session that can go up to an hour. I normally give everyone an hour during that session for us to actually get to sort out all the issues. And yeah, Ashraf, I think I've come to the end, and I think we can just take the questions now.
Yes, thank you very much. That was quite a detailed and I think very useful and informative contribution. There's at least two people, Ingrid Baloyi and Leo Maestri, whose names I remembered now, that said thank you very much for that direct support that you had provided. So I'm going to stop sharing your slides unless there's a slide that we may want to get back to. You can perhaps share it again, or I can share it again for you. We have quite a few questions there that have been answered. There are, I think, quite a bit of questions I think you've covered in your actual presentation, which came from the chat box. You know, things like difficulties people have had, technical sort of difficulties, etc. But if I can go to the Q&A box now for you and Nonhlanhla, there's a Wheelwetu, Tatiana, and the question here seems to be a follow-up. The reason for my question is that in the last webinar of OHSS, the impact of COVID-19 workplace was specified, but with no proper and responsive data submission softwares, it has been totally impossible for such to occur. Can this matter be addressed, because seemingly we have common challenges in making submissions with CSVs? This seems to be something specifically linked to CSVs, and I'm not sure if this was perhaps resolved by the new system that's been put in place. Over to you, Nonhlanhla and Lesedi.
Okay, thank you so much, Ashraf. So just to explain or give a little bit of background why people are having a lot of technical issues with CSV. So previously, before we moved on to the newest system, which is the CSV upload platform, we used Nextcloud. Nextcloud used to just accept any file. People would upload an empty spreadsheet. Nextcloud would take that. So it didn't have any validations in it to actually be able to validate the data before accepting it into the system. So for example, if a person would have uploaded a case with an incorrect ID number or with a name on the ID number column, Nextcloud would take that. But then that would be an issue when the very same person goes to the Department of Health and wants to train for TERS, because the data would not have been submitted to TERS, because when it comes to us, we now had to do a lot of cleaning with that. And trust me, as much as that Nextcloud would accept that sheet with no ID number, but when it comes to us, that is data that we cannot use or even forward to the Department of Labor. So it did not really serve the purpose of this system. So what we had to do, we now had to come up with a system that would actually help us get the submission right from the user side to, number one, limit the type of queries that we're having or even waste our users' time themselves. The system now tells them when they try to upload that something is definitely wrong with your CSV. So it means that when your file is not accepted, you know something is wrong, you have to fix that. And we know most of our users are not tech savvy or familiar with the computer language. So they're more than welcome to actually forward screenshots of the areas that they're finding to us, and we'll be able to actually assist them in getting to explain to them what is it the system that is saying to them with that error message and how to resolve it, which those are the issues that I actually get to tackle during my one-on-one sessions with the users. So in as much as we are dealing with all South African businesses, which it's a lot, but we try by all means to make sure that every request that comes through, we actually try to get to it and resolve it. So that's why I'm encouraging every user to actually make use of these one-on-one trainings that we are offering, so they can actually get to be familiar with the system and know exactly what to do. Thank you.
Thank you, Lesedi. And I noticed you did post your email address. There's been a few requests, particularly from Jenny Mika and others that followed her for your email address. I see you did post it. I just want to post it in the box that everybody can see it.
Yes.
Because I think you might have sent it only to me. So for the oops, what's happened? It's not pasting. So let me just double do that again. Right click, copy into the everyone box, paste, and you should be seeing Lesedi's email address appearing in the chat box, everybody who's asked for it. The last person was Ilana Erasmus that also asked for the email address. So you have the email address there. Please copy it and email Lesedi also directly if you need that direct support. It just seems like some people, things are working well. And for those of you that do have difficulties, Lesedi has offered that direct support as well. And you can hear that there's been many of those sessions that's been done. Okay, so I'm not sure if this has already been answered, Lesedi. Izetu Nduli is asking, when will these changes take effect? And I'm not sure that relates to the new system, which I understand is already in place. Lesedi?
Thank you, Ashraf. So the new system came into effect from the 1st of August last year, 2021. So if you're still trying to access Nextcloud, then please email me the name of your business, and then I will get to give you access onto the new system. But you can also do this from your side alone. You can just navigate onto the OHSS system. You go onto the OHSS site and click on upload CSV. When you get there, you go onto forgot password. You put in your business ID that was issued to you when you were registering and the email address of the person that registered as the contact person. The moment you do that, you will receive a link to set up a new password for this new system. But if you fail to do that, you're more than welcome to send me an email and I will assist you with that. So this also means that to everyone that has been trying to access Nextcloud and they are not yet on the new system, once you get access to the new system, you need to upload all the cases that you did not upload since the 1st of August 2021. So you need to upload them onto the new system. When the new system came into effect, we did away with Nextcloud. So Nextcloud is no longer operational. Thank you.
Thanks. So Jill Langenhoven, your question has been answered. Nextcloud is still functional? Question mark was your question. That's just been answered by Lesedi. Just to Nonhlanhla, there's a question by Marika White. I think this is for you. Would we be able to have access to these statistics for our own businesses? And there's clearly a reference to the kind of, I guess, global report you provided. And are these statistics available for individual businesses? Nonhlanhla?
Yes, the report it's now on the NIH website. I think our communication team will be also distributing the findings to the OHS users, so they'll be sending emails to those. I think when you're registering your company, those people that submit their email, so we'll be sending the report to all companies, and also once we have infographics, also we'll be sending that, distributing that to all workplaces. And yeah, I think if that answered the question, yes. And then the presentation will be available, right, Ashraf, on the
Yes, I
yes,
think
on the,
Prof has also answered somebody on the chat box, yes, that as usual, the presentations are uploaded onto our website, which is 0 rated. You are not charged any data when you go to our website, as well as we send everybody in our confirmed attendance register, the links for the website, the YouTube, etc., and so on. I'm not sure if Marika's question is linked to the disaggregation of the data and the statistics, and can the statistics for an individual business also be accessed on the system? Nhlanhla?
I think individual companies are able to view the submission history. I think CIMO will give you a summary statistics of the data, like give you a report, your own company report. I'm not sure with CSV and API, but I know you are able to get statistics on the CIMO platform. So maybe if you can just send us an email and we can check that for you on CSV and the API platform.
Okay, thanks. So the next one also is about, our staff does the screening on a printed page. Do I have to transfer the data onto the Excel screen and submit? We have 10 different branches and struggle to get the registers from some of the branches. Is this mandatory to submit the symptom screening? My immediate answer, having listened to the presentations, is yes, but I'm going to ask Lesedi and Nhlanhla just to quickly answer you, Lisa. That's from Lisa Kraus.
Okay, thank you, Ashraf. So yes, it is mandatory that you submit the data, but also just bear in mind that on the symptom screening, you do not submit everything that is on your symptom screening sheet. To us, you submit the employees that presented with positive symptoms, which are COVID-related symptoms. So from your screening sheets that was completed manually in your company, you take those that had positive symptoms there, you fill that into our template, and then you submit. Thank you.
Thanks for that, Lesedi. Just trying to find my unmute function there. And then Pamela van Wyk has a question. All my data entered prior to November 2021 disappeared off the CIMO platform. I contacted NIH several times, but no reply. Do I need to re-enter all the information again? I think this is during the system changeover. So I'm not sure if Pamela should perhaps just make contact with you directly, Lesedi, so you can perhaps talk Pamela through that process. I get the sense that that might be a more detailed conversation. Lesedi?
Yes, please. Can she email me directly, and then we will talk about it there.
Great, thank you. So Pamela, please just check. It was the third last post there. There's so many thank yous now there. Okay, so Jenny Mika, is asking for, I'm not sure whose address she's asking for, but I will repost Lesedi's email address there at the bottom of the chat for you, Pamela. Okay, so Jenny asks, if you've battled to register and now you're able to do you have to do retrospective reporting? I'm sure that's been answered. Just quickly, Lesedi.
If you failed to register initially, are they asking if they need to upload everything else, all the prior cases?
Retrospective reporting, yes.
Yes.
If you've now finally managed to register, do you need to report backwards in terms of data?
Yes,
okay.
We would really appreciate that you report everything that you have not reported. That is with those that had not registered at all. But if it's in terms of, for instance, you failed to report from when we changed the CSV platform, we changed onto the CSV platform, so you only have to start reporting backwards from the 1st of August. But everything else that you had reported on Nextcloud previously, you don't have to re-report to us.
Okay, great, thanks. Brendan Burns asked, should reporting be happening weekly? I think the answers to that, yes, Lesedi. I'm comfortable to move on to the next question. Is that okay?
Yes.
Great. Natasha is asking, I have just uploaded a document via CSV, however, it does not show under submitted documents. I've selected the correct form. Do I recommend that Natasha gets in contact with you, Lesedi, if she has difficulty still?
Yes, can she also email me directly?
Great. So Natasha, you'll see that I've posted, did I? Oh, I didn't click send. Oh, there we go. So Natasha, they also, the very last entry to the chat is from me with Lesedi's email address. Okay, then there's a thank you from Tanya McGee. Peter, what about cases not acquired during business hours? I'm sure there's a very quick answer to that, Lesedi.
Yes, it does not matter how the case was acquired, how the person got infected, whether it was at work or not. For as long as it's an employee under your company, that case needs to be reported to us. Thank you.
Okay, great. So Daniel de Villiers, you did see Lesedi's email address. Please check there in the chat box. So is that for Lisa Kraus. Oh, this is a sequence of people asking for your email address, including, I think it's Ms. Gladla. And then lots of thank yous, even in the Q&A box. Then there's Petulia Williamson. I think Nonhlanhla is typing an answer there. And so I'm going to leave Nonhlanhla just to type that answer to Petulia. And Lisa says, thank you for clarifying. I'm just scrolling quickly through all of this so we can just get the Q&A box completely clean. So Jean Corrado is saying, hi, I'm using the latest templates, but when I'm trying to upload it, it says, oops, and that just popped off my, oh, there we go. I'm using the latest templates, but when trying to upload it, it says the heading is misspelled. So Lesedi, what should Jean be doing here?
Can Jean be send me an email attach that exact file that is being rejected by the system, and also a screenshot of the error message, and then we will work on that together. Perhaps we will even have that virtual session and do it together.
Great, thanks, Jean. So you might solve that heading sort of error message that you're getting in that way. Leonor Daniels is asking to know where it comes to vulnerability information or the data that you indicated the different forms may be requiring. Is it important that all employees need to give their information? So Lesedi, Leonor wants to know, is it important that all employees needs to give their information? Over to you.
Okay, so in terms of vulnerability information, it really lies upon the employee themselves to whether they want to disclose their vulnerability status or not. I don't believe employers can actually force an employee to actually disclose such information. So it becomes a responsibility for the employer to actually report the information to us once that information has been disclosed to them.
Okay, thanks. And then we're down to the last few questions here. Sipo Mello says, I understand they are in the positive section and I need them in the return to work. Okay, that's just Sipo confirming his understanding. Kim Tor is saying if staff contact COVID outside of the office and have not been to the office since the contact positive test and go straight to isolation without coming to the office, we still need to submit the information. For example, during the December holiday, my immediate gut reaction is yes, but Lesedi, if you could just confirm, that's my understanding, that all cases involving employees needs to be reported.
Yes, you're right, Ashraf. It has to be reported.
So Kim, there you have it. Please just add those details and that information to the system. If you have any challenges, let us know and email us. Thanks. Wellington, I think, is the last person that I have here now. Kim says, thank you very much, Lesedi. So Wellington is saying, hi, no one ever responds to the email OHS support. Wellington, I think that email address is no longer operational for a very long time. I think the email address that is applicable, and Lesedi can just guide me here and correct me. It is OHS workplace. So replace the word support with workplace. No spaces. You can have them all in lowercase. OHS workplace at nih.ac.za. That's for everybody. Please, a reminder. The official OHSS email address is OHS, 1S, workplace. Sorry, am I correct, Lesedi? Not two
Yes,
S's,
you are.
right?
Yes, you are.
OHS, 1S, workplace at nih.ac.za. So Wellington, that's a quick response to you. in terms of your question with regard to the workplace. Ronald Wundler is asking, do we submit to compensation fund if they immediately recover? Lesedi or Nonhlanhla? Ronald Wundler, do we submit to compensation fund if they immediately recover?
Okay, so all the positive return to work and vulnerability cases, these data, when we receive it, we actually submit them to the Department of Labor. So you as a business only go to the compensation, the TERS compensation fund, should you wish to make a claim for the employee. So all the data is submitted by us to them. And should you wish to make a claim, that's when you go to the compensation, the TERS compensation fund.
Okay, thank you. Thank you very much for that. And then I think I've got my final question. That's from Susan Key. If an employee contracts COVID while visiting another country overseas, that is, for example, not within South Africa, probably Southern Africa, African region, or outside of the continent. So do we need to submit this data?
Yes, please.
Okay, that's short and sweet. And Susan, if you do have further clarification on that, please contact us. Email. I think emails are better to manage. Phone calls sometimes gets to lines that you're welcome. Susan is just saying thank you to Lesedi. So yeah, a phone call sometimes gets to lines which are occupied by conversations, and the lines are not always open. So I think Susan Key, thank you, has taken us home with the last question. I don't see any specific questions in the chat box. Just lots of thank yous and people putting email addresses, Lesedi, which we just need to take notice of, because some of them I think may want us to email them. So at this point in time, Nonhlanhla, is there any, I think Nonhlanhla has already left for our other meeting. I don't see her here on the yes, okay. So on behalf of the team, firstly, on behalf of the attendees, Lesedi, thank you very much. You have been most helpful from my point of view, and that's a bit biased as a colleague, but I think that's accurate and correct. And then to everybody who's with us for the official time period that we intended the session to take place, as well as the additional time, we thank you for your patience, for being around and asking all of your questions. If you have follow-up questions that we've not managed to answer, or you haven't had a chance to type as fast as other people like Ronald has done, please use that email address as indicated by Lesedi. Our question and answer box is empty. And at this point in time, on behalf of the team, that's Professor Nisa Naika, Dr. Nonhlanhla Totleng, and Ms. Lesedi Monaiwa, thank you very much for joining our session today. And please ensure that if there are colleagues of yours in other companies that have not yet registered, have not yet submitted, please let them know. This tool is essential for ensuring that not just that we get clean out of the COVID pandemic that we are currently potentially easing out of, but we can deal effectively with future matters of this nature. Bugs and viruses that comes along becomes a huge public health issue, and then afterwards starts to also, well, simultaneously starts to affect us in our workplaces. And in order for us to be faster and quicker at regaining our composure, our balance, to get our businesses back and our companies and our public sector workplaces back to full working order, it's important that this data helps us in the future to be more ready, to be more sharper in terms of our emergency responses to public and global pandemics. Thank you very much, everybody. This is the end of our webinar. Lesedi, thank you very much to you as well. And we look forward to the support you're going to provide to our colleagues. Wellington is asking Nonhlanhla to please contact him there. It's Lesedi, if you can just note in the Q&A box before you log off, that message from Wellington giving his email address as well. Oh, Trevor Bosch is wanting to extend us a little bit. Let me just entertain Trevor. Trevor's asking, do we still have to log COVID cases on the RMA? Lesedi, can you assist with that?
RMA, can Trevor please
Look,
explain?
RMA is essentially a private compensation administrative body. I think they deal particularly, I'm a bit confused now with the mining sector and or other sectors like engineering, etc. Trevor, could I just quickly find you and give you the opportunity to open your microphone so you can just explain? Now you in the system a couple of places here, and I hope I'm going to activate the right one for you. You'll see a little box appear on your screen, and please, if you accept that, then your microphone function will be open, because I think it's just important for the SAD to understand the context and background of your question. So Trevor, can you see that? I'm not sure which device you are now. I've got you 1, 2, 3, 4, 5, 6. It seems like there may be colleagues of yours also. I'm promoting the first one at the top of the list. If you can quickly accept that. Okay, it doesn't seem like it's working with Trevor at the moment. Okay, so it's essentially, in my understanding, Lesedi, like the compensation fund, is a public entity under the Department of Employment and Labor. The RMA is one of those entities that is private administrators, etc., and have been given the authority to. So my question, answer, I think, is that all COVID cases got to be logged with or reported and registered with a compensation fund. And my sense is that probably would be applicable to other bodies that does similar administration. I am a bit on shaky ground there. Lesedi, maybe you want to contact Trevor Bosch and just give him feedback after we've maybe gone to secure proper information. Is that okay?
Yes, please. And he is also more than welcome to just drop me an email, and then we can actually get the right answer to that.
Okay. Trevor, that's it. I'm not accepting any more questions. We have gone way beyond our time, although I must believe this has been a most productive webinar. So at this point in time, I am Jean Corrado. I see your hand is up. I'm not sure if you want to ask a final question. I'm going to just quickly give you the opportunity to have the microphone. Okay, so, well, Trevor is actually Neo. So I'm in that little response in the Q&A box. Please, Neo, use the email address, email Lesedi, and she will answer you. Okay, so I think that one hand that was up is not going to accept the opportunity to speak. Wilwetu, you want to say something? I mean, I'm going to just see if I can get you in. I'm trying to, and if you can get in the next 10 seconds, I'm going to allow you to ask Lesedi something. Otherwise, we will be forced to end the session in the next 30 seconds. Okay, that's not working. Sorry, Wilwetu. I'm going to ask you to please email Lesedi. And at this point in time, Lesedi, thank you very much. And to all of the attendees and participants, thank you very much. Please extend our thanks to the rest of the team, Lesedi. And that's it for today's webinar. Thank you, goodbye, and we'll see you on the next webinar. Please look out for our general webinars. Wilwetu, I see that you are able to speak now. Do you want to quickly come in? Open your microphone.
Hi, Ashraf.
Yes.
I wanted to come and assist you with a question that related to RMA.
Please proceed.
RMA, yes. RMA is basically run mutual assurance. I work for an automotive manufacturing company. So I basically deal with IoT claims, incident reporting claims, and also COVID-19 and COVID-19 as a part of, the disease claims as well. So basically it works the same procedure as the Department of Labor in terms of the compensation. That's what I wanted to respond with. Yes.
We are very thankful. Thank you very much, Wilwetu, for offering that information. We really appreciate that. And on that note, thanks to Wilwetu, we are in a position to now close the session. And we look forward to you also joining us on our other general COVID-19 sessions. a big announcement on the 21st of April. We are going to have what we call a centenary webinar, which means we would have by then reached 100 of our webinars. You are attending the number 92, the 92nd webinar in our series, which started in March 2020. We are going to be sending out to all of our mailing lists, including to you, the invitation to the 21st of April centenary webinar, where there's quite a significant number of very important speakers who's going to look back over the 2 years and see what are the lessons and also what are the things we can do to ensure that we are going to be better prepared for future pandemics and emergency responses to these pandemics. But to you all, over the last 2 years, or at least since the Department of Labor has made this database necessary, we thank you for your contributions, because you've made, with your work, the administration you're doing, etc., you have made the database appear from nowhere and from nothing, and it has been most useful in making informed decisions with regard to dealing with the pandemic. So thank you very much, everybody. Thank you. Goodbye.